मेरा इमेज नहीं आ रहा? हाँ. Hello friends, we are going to do a quick recall of the FMGE July 2025 biochemistry questions, whatever we have got from you all. Obviously there would be some discrepancies with the statements, some discrepancies with the options, but we have tried to be as extensive as possible and do a good recall. If you have some feedback regarding these, we would be more than happy to modify the questions so that the final content which is going on the platform is comprehensive and correct. Okay, so starting with the first question, we had this question talking about the Marfan syndrome, and various genes were mentioned. Some feedback that we got was fibrillin 1, fibrillin 2, collagen 1. Some students said elastin, some students said no, elastin was not there, so we are not very sure about this elastin thing. But fibrillin 1, as you know, is the defect in the Marfan syndrome. Fibrillin 1 is the defect in the Marfan syndrome. Typically you would find the fibrillin 1 in the long bones, the outer layer of long bones. Then you can find it in the zonules of lens and in the large vessels. And these are the places which are related to the presentation of the Marfan's syndrome. You have the long limbs, the long bones are extra long, the lens is dislocated, coarctation of aorta is there due to the weakness of the vessels. So these are the places where the fibrillin 1 is there. Fibrillin 1 is regulating the deposition of the collagen. It is regulating the collagen deposition. So when it is defective, unregulated deposition of collagen happens. So remember, in this case, what is happening? You have normal collagen. The collagen is normal, but what is happening is unregulated deposition, which distorts the architecture of the extracellular matrix, and thereby all the presentations are happening. Fibrillin 2 has some common features with Marfan syndrome, and it is causing the clinical scenario known as congenital contractural arachnodactyly. This question has been asked in the past in one of the NECT papers, so you should know about this name also. Congenital contractural arachnodactyly associated with the fibrillin 2, whereas fibrillin 1 is associated with the Marfan syndrome. Collagen, you know, is commonly associated with the osteogenesis imperfecta and the Ehlers-Danlos syndrome. So this was the question about the Marfans, the affected areas you should know, and you should also remember that the collagen in this case is normal. There is no problem in the collagen. What is the problem? That is the unregulated deposition of the collagen. Then we had this question, lactic acidosis due to deficiency of which vitamin, and I have been following the discussion on a lot of our groups, and lots of controversy in this question. First and foremost, let me tell you that lactic acidosis will happen when two conditions are there. Number one, anaerobic conditions, means strenuous exercise, or there is defect in the metabolism of pyruvate so that it cannot go forward, and then it will be recycled. Okay, so when it cannot go forward to the metabolism, that is when the problem occurs. The forward metabolism is commonly done by the pyruvate dehydrogenase. Now the source of all the confusion and conflicting debate is that PDH contains 5 coenzymes, right? And any of these coenzymes, if they are not working properly, then they will affect the PDH and lactic acidosis will happen. But what you have to understand is, which I tell you again and again and again, when you get a question where multiple correct answers are possible, in that case you have to mark the most common, most likely, most commonly seen condition. Okay, so lactic acidosis due to deficiency of the vitamins will be most commonly seen in patients who are chronic alcoholics, and in chronic alcoholics the problem will be the vitamin B1 deficiency. In chronic alcoholics, because alcohol interferes with the absorption of vitamin B1, chronic alcoholics also have poor nutrition. So in these cases, vitamin B1 deficiency will be seen. This is the most common deficiency giving rise to lactic acidosis. It can happen with riboflavin deficiency, it can happen with niacin deficiency also. But when we talk about lactic acidosis, we talk about inhibitors. We mention the role of arsenite and mercuric ions. We mention the chronic alcoholics, and we mention the inherited deficiency of the pyruvate dehydrogenase. These are the three common causes for lactic acidosis. Rare causes are many. Rare causes are many. For example, all the mitochondrial DNA disorders will present with lactic acidosis, but these are the ones which are common causes for lactic acidosis. Alright, so among the vitamins, typically we talk about the vitamin B1 deficiency. So your answer should be B1 thiamine. Moving to another question which was asked, the child with breastfeeding presents with lethargy, hepatomegaly and cataract, most likely enzyme deficiencies. Now here you have to keep in mind two things. First, they have told you, okay, we are not sure about the options, probably these were the options as I have got from the discussion. First, you have to look at the information given in the question. They are saying that breastfeeding. So you can assume that the age would be typically less than 6 months, not hard and fast, not very strict, but approximate age. Then the presence of lethargy and hepatomegaly. This can happen in two conditions. You can have the galactosemias, you can have the hereditary fructose intolerance, but the age of less than 6 months rules out the hereditary fructose intolerance. Why? Because currently in the diet there is no fructose. The breast milk will contain lactose, breaks down to glucose and galactose, so no fructose. So HFI is ruled out, you are left with galactosemia. Now galactosemia is verified by the presence of cataract in the newborn. The cataract can be there in the galactosemia, which is the most common type, due to the deficiency of uridyl transferase. Okay, the cataract which is seen here is the oil drop cataract, also known as a metabolic cataract, due to the deposition of galactitol. Galactosemia can happen due to deficiency of galactokinase also, it can happen due to deficiency of epimerase also, but most common and the one where you see the cataract in the before the first year of life will be due to the uridyl transferase. So remember, you have to mark the most likely, most common, most easily seen conditions or options. Okay, multiple correct answers will be there in a lot of questions, so you have to be very careful what you are marking. You cannot come out and debate, I marked the second one because that is also true. No, you have to be accurate in the sense that you have to mark the one which is more likely. Okay, coming to a very commonly repeated topic, a patient has been diagnosed with a carcinoma with a positive family history of hereditary non-polyposis colonic carcinoma. In another version of the question, it would be written as Lynch syndrome, also known as hereditary non-polyposis colonic carcinoma. Which of the following DNA repair mechanisms is likely to be defective? Now, if you've not revised DNA repair mechanism before going for the exam, it is your mistake. We keep telling you DNA repair mechanism, that one single table, one question will always come, so you have to revise it before you go for the exam. And I'm sure most of you have marked this as the mismatch repair. Mismatch repair is resulting in hereditary non-polyposis colonic carcinoma. The base section repair will give rise to mute-Y homologue associated polyposis. Okay, mute-Y homologue associated polyposis, subtype of familial adenomatous polyposis. The nucleotide excision repair gives rise to the spectrum of disorders, the xeroderma pigmentosum, Cockayne syndrome and the trichothiodystrophy. Double stranded break repair will give rise to the SCID and the radiation sensitive SCID. If we had the single strand break repair, in that case, you know, the answers would be the Bloom syndrome, BRCA 1 and 2. So those will be the names that we'll talk about in the single strand DNA break. Okay, so in this case, for HNPCC, we have to mark the mismatch repair, Another very controversial question, lots and lots of discussion because we are not sure about the inputs. However, what I could make out, the question mentions high triglyceride and high chylomicron levels. Other points were not given regarding the blood levels of the other parameters. And in addition to that, it mentions that eruptive xanthomas are there. Now, eruptive xanthoma directly related to the high triglyceride, but the other parameter which is mentioned is the high chylomicron. Now, if you remember the table that you look at, okay, so see the high chylomicron alone, in this case you have chylomicron plus VLDL, here you have the VLDL where we have the elevated triglycerol, triglycerol, but chylomicron alone mentioned in the question should give you the inclination that we have to mark the type 1 as per the classification. And I keep telling you that type 1 and 2A are the ones which will come in the exam. These are more common, more likely to be asked, because these are the ones which the examiners expect you to see when you are seeing the patients, right? That is why 1 and 2A is the one where we will ask you the biochemical abnormalities and the presentations that is there. Okay, so answer should be type 1. Answer should be familial hyperlipidemia, a type 1, where you either have the lipoprotein lipase deficiency, enzyme deficiency, or the translocation deficiency, or the C2 deficiency, which is required for activation of lipoprotein lipase. Okay, so here I would suggest that answer should be type 1. Now, this was a slightly ambiguous recall. It was an image based question where we got the feedback that probably the KF ring was there, which implies that we are dealing with the Wilson's disease. It was not explicitly mentioned that we are dealing with Wilson's disease, but only the image was there, from which you can extrapolate that yes, we are dealing with the Wilson's disease. And then the question is best investigation to confirm diagnosis in this patient. Now, when you have a suspected Wilson's case, a lot of parameters might be positive, but confirmation is only by the quantitative assay of copper in the liver biopsy sample. This is the only confirmatory test. All other are indicative, they are suggestive, they cannot confirm. Confirmation is only by quantitative assay of copper in the liver biopsy. All right, so you have to remember this, the liver biopsy followed by quantitative assay of copper in that particular sample. This is the only confirmation that can be had for Wilson's. Okay, here again we had a lot of different versions coming from the different students. A person consumes a diet predominantly of rice and pulses. Some students said sir polished was mentioned, some students said sir polished was not mentioned. We are not sure whether polished was mentioned or not mentioned. Let's assume it, even if it was not there, but you know that most of the rice and pulses that you get in the market is generally polished. Okay, you have to be very specific when you want the unpolished rice. So normally if you are taking the rice and pulses from the market, they happen to be polished, okay, because they look better, they shine, so there's a good marketing aspect to that. Now this person presents with fatigue and mild neuropathy. These are symptoms from two spectrum of the conditions. We have the dry beriberi and the wet beriberi. Dry beriberi will cover the neuropathy, wet beriberi where you have the presentation of heart failure, high output cardiac failure. So that is the fatigue part. So meaning we are dealing with the vitamin B1 deficiency. So you're seeing again and again we are getting questions from the vitamins, and this is not surprising. I have been telling for the last 2 years, in your whole MBBS syllabus the most high yield topic is the vitamins. If you have not revised vitamins the previous night to the exam, you are committing harakiri. 4 to 6 questions from vitamins will always be there. You cannot say that sir we did not know. This is the most common advice to you. You have to revise vitamins the day before the exam, because you are guaranteed to get 3-4 questions minimum. Sometimes we have had up to 8 questions in there. Okay, so we've got the comment that sir polished rice nahi likha tha. So even if we ignore that polished rice was not there, what I'm telling you is commonly the rice and pulse that we get from the market happens to be polished. Okay, so in this case again it should be vitamin B1 because both neuropathy and fatigue covered by the beriberi. Now this is another topic which I keep telling you, and this is from where we start our discussion of biochemistry, that that uh, if examiners expect you to know the sampling process. I got a feedback, sir, actually was not in the option. Vitamin C was not in the option. No problem, no problem. I'm sure A B C K. Okay, O A B C K. All right. Okay. Okay. Thank you for the information. A B C K. All right. So coming to this question, you are an intern, want to study coagulation profile, which vacutainer is used for collection of the sample. So again, I always tell you that the idea of the paper is to make sure you know things that you will most likely be doing as the postgraduate students, the patients you'll be seeing as postgraduate students, depending on which department you go in. But one of the primary duties for the postgraduates would be to supervise the collection of the sample. Okay, now the Nadeem is saying that B1 was not in the option, rather it was written as B. Even then it works for us that you have to give the supplementation of vitamin B complex. Okay, even if B1 was not there, we can go for supplementation of vitamin B. Okay, so you must know the sampling and the vials which have to be used for sampling. Nowadays we have the color coded vials, and they have to be used in a particular sequence which we call as the order of draw. This is the very important topic, very hot topic, very frequently asked for the last 3-4 years, and always we talk about these colored vials where you do the first for the blood culture, then you go for the coagulation study. So you see this blue top is for the coagulation studies. So in our question the answer should be the blue top should be the answer when you want to do the coagulation profile studies in the sample. I'm sure you know about the other vials. The red one or the golden top is for the serum biochemistry, the lavender and the pink is for the blood counts, the gray vial is for the estimation of blood sugar. These are the routine ones which you have to know. Moving to next question. A 10-year-old is having extreme muscular weakness, particularly on exercising. Which glycogen storage disorder? So this is what we got from the students, and different names were there. If you can verify that these options were there and this was the statement of the question, because here I did not get a lot of feedback in this question. Okay, so what you have to remember in the glycogen storage disorders, type 5 and type 7, these are the ones which are specifically related to muscle and where you have exercise intolerance, either due to pain or due to weakness. The person is not able to continue the exercise in GSD type 5 and GSD type 7. GSD 5 is the McArdle's and type 7 is the Ruiz disease. Okay, generally not asked. Sometimes you get the question on type 5. In GSD we mostly get the question on 1 and 3. Okay, so when it says exercise intolerance, you have to think about 5 and 7. Muscle weakness, hepatomegaly. Okay, hypoglycemia was in the question. If it mentions the hepatomegaly and hypoglycemia, if hepatomegaly and hypoglycemia is there, then the answer changes, right? If hepatomegaly and hypoglycemia is there, in that case type 5 will be out. All right, the hepatomegaly would be featured in type 1, 3 and 4. Weakness, hepatomegaly, hypoglycemia. In that case the best answer would become the glucose 6 phosphatase deficiency. that is type 1 or the von Gerges disease. If the question says that it was having the hepatomegaly and hypoglycemia along with weakness, in that case the answer should be von Gerges. Otherwise, if it mentions only the muscular weakness and no other points, in that case the answer will be type 5, and that is the McArdle's. Okay, so that is how we have to attempt this question. Okay, any other person has comments regarding the options in this question? I got one from Dr. Nadeem, where he's saying that weakness, hepatomegaly and hypoglycemia were mentioned. Okay, they ask about enzyme deficiency, not the name. They ask about enzyme deficiency. In that case, it is the glucose 6 phosphatase. Hypoglycemia, hepatomegaly, and in question ask about enzyme deficiency. Okay, in that case we go with the glucose 6 phosphatase deficiency. Okay, because this is the one where you have the most severe hypoglycemia, which can be associated with even fainting episodes. Okay, one student told me that, sir, we also got the question on the Fabry's. It was a one-line question, but others have not supported this claim. I'm not sure if this question was there or not. Only from one student I got this, that there was a question on Fabry's one-liner. If you can confirm this question, was this question there? Fabry's disease, which enzyme is deficient in Fabry's disease? Fabry's disease is the exception in the Sphingolipidosis because it is having the inheritance pattern of X-linked recessive. There is no mental retardation and there is no cherry red spot. That is why this is frequently asked in the question. Frequently it is asked in the exam, and I'm sure all of you are familiar with this table, where the Fabry's disease is due to deficiency of the alpha galactosidase, Okay, so in this case you have to mark the answer as alpha galactosidase. It is simple one-liner question. No other clinical scenario was described in this question. Please note, in this table you must be knowing about the 4 enzymes. First is the Gaucher's, second is the Niemann-Pick, third is the Tay-Sachs, and fourth is the Fabry's. These are the ones which will commonly come in your exam. Most common is the Gaucher's because we have the specific crumpled or wrinkled tissue paper appearance, which is commonly given as the image-based question. Okay, so now we have this question where the image was given valgum deformity and the person is using the stick. Question says whole village uses stick for walking and similar clinical features are there. What do you check for? Now, I'm not sure what the image was showing, whether it was showing a grown-up person or it was showing a child, because valgum deformity should be there in the children, and in that case you are going to be looking for the fluoride level. But if it is not a child, if it is a grown-up and it gives the appearance of valgum deformity, it can very well be the osteolathyrism. The background of osteolathyrism is during periods of stress, during famine, when the scarcity of food is there. The whole population is consuming the Lathyrus sativus, and that is when the neurolathyrism, osteolathyrism will crop up, and the whole population in that particular area will be affected. Okay, so Dr. Bhim is saying that 40-year-old mentioned. In that case fluoride level goes out. Because valgum deformity is a developmental deformity. In fluorosis, that valgum deformity in 40-year-old will not happen. It will not happen in the 40-year-old. In that case, you have to think about the osteolathyrism. And in these individuals, supplementing with vitamin C levels improves the condition. Why? Because in osteolathyrism, the lysyl oxidase will get blocked. Lysyl oxidase is responsible for cross-linking, where it forms a covalent bond. But when you supplement with vitamin C, then you have increased number of hydrogen bonds, which somewhat supplements the effect of the lysyl oxidase deficiency. So if vitamin C levels are topped up there is improvement in symptoms. There will be improvement in symptoms. Okay, so and let me tell you that this is a repeat question, exactly similar question, that the whole village is consuming a particular type of crop and they are having the skeletal deformity, everyone needs support to walk, what supplementation will be given. This question has been asked previously, it is a repeat question. So a lot of students saying it's a biochemistry, no repeat question. I beg to differ, whatever we have discussed till now, almost all of them are repeat questions, almost all of them are repeat questions, only the presentation is slightly different. But I always tell you, exact question will not be repeated, the topic will be repeated. Fluoride, not fluoride mentioned, very good, very good. Fluoride is not mentioned, then no problem. And one option was calcium, yes, one option was calcium. I got 6 options in this, so I had to remove 2. So calcium may very well be there, I don't doubt that calcium would be there. Okay, but I'm telling you the concept. See, I'm telling you the concept because if there is fluorosis and the amount of fluoride in the water is high, more than 10 micrograms per liter, in that case you get fluorosis, and in the children you will have the valgum deformity. Okay, in the adults will not have the valgum deformity, but fluorosis will cause the deformities, and crippling is the presentation in that particular case. Okay, but in osteoarthritism, again you will see the presentation in the whole village, just like you see in the fluorosis. In fluorosis, there is still scope that if different water sources are being used, the whole village might not be affected. Okay, but in the osteoarthritism, generally it is predominantly in the whole population. Then we had one question talking about the substance which can eliminate a free radical from the body. Okay, in that context you have to remember the 4 molecules. Number 1, vitamin E. Number 2, vitamin C. Number 3, GSH, which is glutathione. And number 4, NADPH. These are the 4 names which you have to remember, which will eliminate the free radical from the body, Please note, selenium by itself is not an antioxidant. In the past it was assumed that selenium is an antioxidant, but selenium is present in antioxidant enzymes. By itself it doesn't have any antioxidant activity. It present in the antioxidant enzymes in the form of the 21st amino acid, which is the selenocysteine. In the form of selenocysteine, it is present in lot of antioxidant enzymes. Okay, so that is how the selenium is having a role. It is having a role of the antioxidant, but by itself it is not an antioxidant. Okay, another option is glutamate. Thank you. Another option is sulfur. Great. So out of these your answer is glutathione, without any doubt your answer will be glutathione. Okay, so these are the 4 main antioxidant molecules. In addition to this, we have a lot of antioxidant enzymes, but these will be the 4 antioxidant molecules. Then we have some questions for which I could not get the details. I presume this question is from pharma, so it had I got the feedback that it had certain drugs which is mentioned, but what exactly it was asking, which mechanism which was described in sickle cell anemia, that statement I could not get. So I'll leave this question. This is probably related to pharma, where they had mentioned the drugs. These 3 drugs are effective in HBS, but what mechanism they had described, based on that you have to select the correct answer. Then probably there was another question on hyperammonemia. Either the clinical scenario was there and they had asked for the diagnosis. Probably one of the options was orotic aciduria also, but I'm not sure because only one of the students told me that something like this was there. The others were not able to corroborate. Okay, okay. All right, only colored stool was mentioned. Colored stool was mentioned. Then we had one question talking about bilirubin levels and in the infant, and based on that, they are asking to identify which type of inherited hyperbilirubinemia, Crigler-Najjar syndrome 1, 2, Gilbert's, or Dobbin-Johnson syndrome. So until unless okay, biliary atresia was there in the option. Biliary atresia. So until unless we have the exact values, what was the value for the indirect bilirubin, what is the value for direct bilirubin, it will be difficult to tell you the correct answer. However, you know that Crigler-Najjar syndrome 1, 2 and Gilbert's, these will be predominantly having the unconjugated bilirubin which will be elevated, whereas in the Dobbin-Johnson, Rotter's, biliary atresia, in these cases it will be the conjugated bilirubin which will be elevated, right? So, and probably like someone also mentioned that we had another question on von Gerke's. Probably it was asking about the enzyme deficiency. I'm not sure. One specific question directly talking about von Gerke's. Okay, so Dr. Nadeem also said that we have two questions on von Gerke's. So see, it reinforces, the paper has reinforced what I keep telling you. Number one, vitamins. Number two, inborn errors of metabolism, and number three, clinical correlation. Okay, besides the general biochemistry, these three would be the first three topics which you would cover, and even then the most important would be the vitamins. If you're doing these, then you have covered majority of the questions. Dr. Bhim has also said that we had two questions on von Gerke's. Was the second question simply asking about enzyme deficiency? Was it simply about the enzyme deficiency? Okay, so we will based on your feedback, we'll finalize the questions and put them. Okay, Dobbin-Johnson was not there, biliary atresia was there. So in that case, if the conjugated bilirubin levels are elevated, you can go for the answer of biliary atresia. The all other three are related to the unconjugated bilirubin level. If the conjugated bilirubin level was elevated, so it will either be Dobbin-Johnson or Rotter's or the biliary atresia. So based on your feedback, biliary atresia was mentioned. In that case, you can go for the biliary atresia as the correct answer. We'll incorporate all your feedback and come up with the final video, which will probably be more accurate than what we discussed here. And I thank you very much for your feedback. This is all that I have for you today. And thanks for joining, and thanks for your active participation, particularly Dr. Nadeem, Dr. Bhim Singh. I appreciate your input. Thank you very much.